Well, this certainly wasn't the test result I thought I'd get. Let's talk about it. So this will be part 2 of my health update, and I've been waiting to discuss this for a while. A while back, I had a Lyme disease panel, which included Lyme disease and other co-infections. While I didn't believe I had Lyme disease, it was a routine test that my specialist recommended due to symptoms and setbacks in previous treatment courses. I had the blood drawn at the hospital and waited for the results to come in. What it revealed was unexpected. It turns out I had Lyme disease and didn't even know it. We don't know how long I had it, and we will likely never know how I got it. The only speculation I can offer is I was once in a previous relationship in which we both took care of a dog. The dog often roamed free when it was not with me, and at one point the dog did bring in ticks where I did get a tick bite. I didn't think much of it, I didn't notice any bullseye-shaped irritation, and I didn't go to see a doctor for it. That was in 2014, I believe. Could it have happened then? Maybe, but honestly I can't say for sure. I live in Virginia, which is a utopia for Lyme-carrying organisms, so this could have happened at any time. I'll never know. Let's discuss the results then. If you weren't aware, Lyme disease is a tick-borne illness that is caused by a number of bacterium. These strains were tested, and I tested positive for one in particular. I tested positive for a prior infection of borreliosis. Borreliosis infection can have symptoms ranging from fatigue, joint pain, rashes, to neurological issues, ocular issues like light sensitivity and loss of vision, brain fog, migraines, and much, much more. It is serious and can lead to irreversible issues in the body. So I said I tested positive for a prior infection of borreliosis. Well, borreliosis can relapse. So, am I suffering from it now? My specialist is concerned about this. She has seen this in several of her patients, and we had this tested as well. The test can show a result of negative, positive, or indeterminate. My results? Indeterminate. What this means is I tested positive for one current type of Lyme antibody, which is not enough to fully determine a relapse. It also means it can't say I don't have a relapse either. Because there's still concern there, we'll have to decide what to do to address this. Luckily, I just finished courses of a multitude of antibiotics as part of a treatment for other issues. We will now monitor the situation and act accordingly. So what about all my other issues like blood pooling, ocular issues, and more? What are we doing about this? I'm going to do a video all about my blood pooling, but for right now, I am experimenting with compression leg sleeves since my blood pressure has improved. This will not magically fix anything, but it may slow blood pooling down ever so slightly. The rest of things are up in the air. Due to the virus plaguing the world right now, any attempts to further clean where I am living have been halted for now. I am augmenting my binder regimen, and my specialist and I are discussing other ways to adjust treatment. We have a victory in managing a significant symptom, which is good. We have more information, which is good, but we have a long way to go. In the meantime, I plan on challenging myself more to do what I can in spite of my chronic illness. I have been working on these challenges and writing them out in order to figure out ways to accomplish them without hurting myself. And this time I have learned more about accessibility than I previously have. I am thankful for that. I believe it is imperative for chronically ill individuals to lightly challenge themselves. I remember when after being rejected for physical therapy, I began lifting weights. And by weights, I mean water bottles. And at the time, that was very difficult. That led me to being cleared for physical therapy finally, which was great until I got screwed out of continuing, but more on that at another time. I challenge myself to make these videos. I'm thankful to everyone who watches them. So you can look forward to a video regarding blood pooling, and an announcement video of some sort to come. Until then, please like and subscribe if you haven't already. Leave a comment if you know someone who has or has had Lyme disease. Was it you? Tell me a bit about your experience with it, or what it took to get tested. And with that, I'll see you in the next one.